hair loss is a common disorder that affects millions of people worldwide. And when many are faced with it, they aren't quite sure where to turn for help. Well, this month is all about hair loss awareness and getting to the root of the issue affecting both men and women.
That's right. And tonight we're speaking about everything from types and causes of hair loss to treatment options. And joining us now here live in studio is board certified dermatologist and the founder of MBeauty Clinic, Dr. Tess Mauricio. She has everything we need to know. It's always a pleasure to have you join us.
Great to be here.
So let's start it off right away with the types and causes of hair loss.
Right, so there are different types. The most common one is called androgenetic alopecia, and that can affect men and women. And then alopecia areata, where you have hair loss in patches, and this is an autoimmune disease. And then telogen effluvia, most people don't know about this, but it's usually stress-induced, whether it's, you got sick or you're stressed out. And then some diets, especially now a lot of people are on Ozempic, they can get this shedding, temporary shedding of the hair. But the key is really to go see a dermatologist when you are having hair loss, hair thinning issues. Most people know that dermatologists are experts in skin, but we also are the definitive experts in hair, and we can create a personalized treatment plan and also, diagnose it properly.
As a doctor, how do you diagnose it? How do you find, because there's so many different types and causes, how do you look at it? Do you have to look at the person as a systemic kind of thing, like a whole?
Absolutely, because there's some nutritional deficiencies that can cause it, hormonal issues, so thyroid issues, right? And so you really need to get a full medical history. You want to look at lifestyle as well, right? And special diets, a lot of people now are on those, and a lot of telogen effluviums coming from that. And then sometimes you have to do an actual biopsy of the scalp, and the dermatologist can do that, and we could rule out whether it's scarring alopecia or just androgenetic alopecia. But the good news is that there are incredible treatments, and that is what I'm so passionate about.
Well, let's talk about those treatment options.
Yeah, so
Go
this
ahead.
one is the latest laser technology. This is Vidance Pro Deep. It's a painless treatment, and this is 1340 ND YAP laser. It targets the hair follicles. It increases blood flow. It gets rid of toxins. It activates those hair follicles that are sort of getting tired or not active, dormant, exactly. And so the key is to get treatments early on. Don't wait until the hair follicles are gone and dead. And so that is really the key. And then we can combine this with platelet-rich plasma, that's from a blood draw, and then exosomes as well. And then, of course, medications like minoxidil, finasteride for men.
So we can start early, is what you're saying.
That is the key.
I might have to go see you.
Exactly.
Break down some of the medications. I mean, minoxidil is one of them, right?
Right, so Rogaine, so you can apply this topically. Studies have shown that this has really helped. You can use it once or twice a day. And in our clinic, we can actually prescribe oral minoxidil, which really can help. Finasteride or Propecia is really good for men. It can reverse hair loss. Hair transplantation can be very, very effective. And then platelet-rich plasma, PRP, that is an injection of your own growth factors to encourage hair growth.
Could you correct me if I'm wrong? Finasteride, though, is not great for women who are pre-menopausal, correct?
Correct, because it can block the testosterone hormone, and so you really want to be careful, and it has to be done under the guidance of a physician.
What about some people who don't want to take medications? Maybe they want to try to do it naturally. What would you suggest?
Well, so there are a lot of supplements out there, and I'm all about just doing everything, right? So supplementation, and that's why it's important to seek a doctor's care, because we want to make sure you're not iron deficient, you're not biotin deficient, so you want to target your supplementation. And of course, just a good lifestyle, a well-balanced diet. Hair is protein, and so if you're starving yourself, whether you're calorie restricting or whatever, you're not ingesting enough protein, your hair will suffer, it will know, it will shed, and I'll see you in the clinic.
Exactly.
Yeah, for sure.
So are there people who are more likely to suffer from hair loss? Is it more genetic, or is...
So it depends on the kind. So androgenetic alopecia, and this is a patient, and it can happen young. This is my patient, he's in his early 20s. Men and women can suffer from it, and we really can reverse it if we get to it early.
What about kids? Can they also actually suffer from this?
So there are some kids that suffer from alopecia areata, so that's the autoimmune type, and it really can happen. And then some that are under a lot of physical, emotional stress can have the telogen effluvium.
You know, you mentioned that there's, you know, a lot of like nutrients we can take, the way we eat, things like that. Other preventative tips that you can think of?
Well, you know, taking care of your hair, right? So being gentle, not over processing, don't dye it. Also tight braids and, you know, styling as well can cause some traction alopecia as well. So just being gentle with your hair. But I'm a big believer, I practice what I preach, and you both know I get these treatments done and this is all my hair, and hormones and menopause and perimenopause, that can all change. But the key is that we have treatments.
And ways of preventing it.
You know, between the two of you, you guys got some hair going on here. I mean, I've known you guys for years. It's beautiful.
I know, but I'm going to go see her because
but it's important because
it's important.
hair loss can affect self-esteem and quality of life.
Oh,
so.
for sure.
Absolutely. All right, Dr. Tess, we
Thank
appreciate you coming in
you.
today. Always a wealth of knowledge, absolutely. More information on hair loss awareness will be on our website, fox5sandiego.com. Just click on the Seen on Fox 5 tab. Thank you.
Thanks.